Good evening.
Hi, my name is Vera Foyer. I'm a child and adolescent psychiatrist, and I'm the AVP for school mental health and oversee our school mental health partnerships across Northwell and across Long Island. And Lindbergh this year has joined our partnership, and we're very excited about it. And tonight, with Gina Marie, who's going to introduce herself in a minute, we're here to introduce what kind of programming is available for families through this partnership.
Good evening, everyone. I'm Gina Marie Bounds. I'm an AVP in pediatrics. I oversee all the pediatric subspecialties. And about 4 years ago, we started this behavioral health partnership here with Vera. Um, just to level set for all the freshman parents, I would have no idea who my kid's guidance counselor is. So don't worry about that. So, all right, we'll tell you more about our partnership.
Yeah, so to start, I'm just going to go over this pyramid. This pyramid is really meant to describe and explain that our partnership with schools really extends to all members of a school community because everybody needs some education, some knowledge about mental health, about parenting, about different things around our child's development and how to best support our children. And school staff similarly needs professional training and programs and ongoing development to help continue develop their skills. And kids need mental health education, right? Because New York State actually mandates that in the health curriculum for all schools and all kids K through 12 in New York. And that is something we can also on that bottom level really help support. And again, that's things that all students have, need, and benefit from. And tonight we're going to walk through what are some of the programming that we offer, because as part of that, for parents, we have workshops and webinars and different resources and support groups that we're going to talk about to, again, just help guide all of you guys in this fantastic journey we call parenting. And then at tier two, at the middle level, not every student, but some students have different kinds of struggles, and they can be education struggles, they can be mental health struggles, they can be different health issues that impact them. And in that case, the school and the parents need more help and consultation and evaluations of different kinds with different experts to really assess that and be able to appropriately support each student. So we partner with schools to be able to help support that with expertise that schools don't have. So psychiatry, neuropsychology specialists that schools typically don't employ, we're able to collaborate with those consultations. And at the very top part is our clinical care access, because if you have ever tried or heard a family member try to get access to mental health care in the community, you know what a difficult endeavor that is. And so we really understand that it's not only important to, learn about mental health and identify these issues early on, but also to create meaningful access to then the care that those who we find need more help and support can get. And that is the Behavioral Health Center, which we're going to talk about in a minute. So January will go over some of the community supports.
So, supporting the community was an important part of the partnership because while crisis management obviously was the most critical need, we really wanted to work down that pyramid and try to prevent crisis as much as we could. The other important part about community supports is an important part of our partnership is destigmatizing mental health. It's very quick when your child is limping around because they hurt their ankle in soccer, you're quick to go to the orthopedist, or if your pediatrician said there was a heart murmur, you're quick to bring them to a cardiologist. But fortunately, mental health doesn't have that same action and reaction. So having these community supports was our way of not only helping in educating the community, but really helping to destigmatize mental health as a whole. So we do this in a number of ways. We do community education series, which we do about once a month. We have parent workshops that are usually focused around a specific area. It could be anything from digital parenting to parenting. The parenting an athlete or parenting an elementary school kid. We do have support groups that are specific to what various parents or groups are going through. We do monthly newsletters, which are going to talk about kind of the theme for a month. It'll give updates to the community of different initiatives we're doing. It'll include all our community education and parent workshops. And it'll also keep a YouTube library of any community education series that we've done. So, for example, we've done a great one on bereavement. That doesn't really always apply to people, but a year down the line, something may happen. There may be an event where you may want to go back to that library and look at that again. Probably one of our favorites, which I'm sure Vera will go into a little bit more, is our Cohen Strong Advocacy Program. So I'm not going to steal her thunder, but it's definitely one of our more exciting programs. We also do direct student health education. Talked about our YouTube channel, and Dr. Foya has been known for her very robust and educational podcast.
And the podcast, I mean, we will talk about Cohen Strong because it's the best program. And I'm hoping Limburg students will join next year. This year, we already enrolled our class, but I'll tell you about that in a second. And actually, the students from the Cohen Strong program came and did a podcast with us where they shared their views on how we can reach youth, specifically on substance use and vaping issues. That was the topic. But parent webinars, so this is our offering for this year. You guys are going to get this distributed, and we also work with the school to have the information available throughout the year on the Limburg school website or other ways that the school shares information with you. But we have scheduled the entire series for the year, and you can see the topics. I mean, they're pretty small, so you can't really read them. But like Gina Marie mentioned, resilient parenting, one that every high school parent, I think, should come to is the one we do on academic stress and competition. I think it's a really important topic. We have sibling relationships, how to support student athletes, how to support life after high school and transitional programs and kids in that age group. Again, a variety of topics, a different one each month. And the other series we have are focused on adolescent health topics. So again, very applicable to your high school age students, and it's done by our adolescent medicine team, and it covers things like healthy relationships, body image, healthy eating, home safety, substance use, digital media, relationships, things like that. Gina already mentioned our parent support groups. Currently, there's two sets of support groups that we're running with for parents, and they're part education, part support. It's not a clinical service. It's not somewhere where you have to use your personal information or register or anything like that. It's a Zoom webinar that you register for and can attend. And they're focused on parents with kids that have issues around anxiety and how to support your anxious child. What can we as parents do? What are some strategies that we can use to support anxious children and help, develop their coping and resilience? And the other one is for parents of school avoidant kids, because school avoidance has been such a huge and growing issue in all the communities that we work with, that parents often really need more guidance and help and support on how to manage that. Because as you can imagine, hopefully none of you dealt with it, but as you can imagine, it can be really disruptive to a family's life when kids have a hard time coming to school. So those are the workshops that are running. I'm gonna skip over this because so here's Cohen Strong. So these are the kids last year in Albany and in Washington D.C. with our team actually going to legislators to advocate for mental health reform and issues. And as you can imagine, incredible experience for the kids. They really love it. But the way that the program is structured is that we take student ambassadors, we provide them with mental health, team mental health first aid training, which is a peer counseling support certification that the kids can get on how to support their peers. And then we do training for them on different things like how do you build a project, how do you, what's advocacy, how do you go lobby for change, things like that. And then in the second part of the year, they create a program for their school. So they come back to the school and do a peer-led youth initiative, because we really truly believe that kids a lot of the times are the best way to get our to amplify their voices, to get our messaging heard, so they hear it from each other a lot more often than from us. And then we do take them on advocacy trips and have them involved in things like podcasts. They published articles, they were in the newspapers, so very exciting for them and a really great program. And this year's class has 60 kids from 10 districts, so we're hoping next year, hopefully you'll be able to join as well. And Behavioral Health Center.
So at the moment, we have 3 behavioral health centers on Long Island. The first one, which is the one that Limbrook now has access to, was developed in January 2020. Very interesting timing, and that's in Rockville Center. In blue, you can see these are the school districts that are partnered with that center. We're on Merrick Road. I think it's about like 8 minutes from here. And we are open Monday through Friday, and 4 of those nights, 8 a.m. to 8 p.m. And on the one Friday, we're open till 5:30. But if you notice the other two behavioral health centers, we have another one in Nassau County in Mineola, serving the districts listed above. And then our most recent behavioral health center in Suffolk County is in Comac. And so all of them are open 12 hours a day, at least 4 days a week. There may be one early day, but we make sure it's not the same day. So for example, if there was a kid in crisis on a Friday at 5:30, it doesn't mean that you don't have access to the behavioral health center. It just means we'd have you go over to the Mineola site, which is about 20 minutes away. So on the left, you'll see the pictures. The idea of the Behavioral Health Center was to develop something that felt very non-clinical, non-stigmatizing, non-sterile. So all of our behavioral health centers are in a pretty nondescript building. If you know 100 Merrick Road right across the street from King Cullen on Merrick Road, it's it's a regular office building. There is a pediatrician's office in it that we are co-located with. Mineola the same and Comac are the same thing. They just look like regular office buildings. And we do try to have more of a pediatric or adolescent feel, and we do that with artwork. And most recently, what we hold is an art contest every year for our partnering school districts with prizes. But one of the prizes is that, or one of the benefits for us, I would say, is we actually have the artwork made into the artwork that is displayed throughout our behavioral health centers. So this is specifically the Rockville Center location, which I guess you would consider your main location. And it's important that we try to keep one clinical team with the school district because it really does become an extension of the school district's clinical team. So the social workers, the guidance counselors, psychologists for every school district start to know the name, the cell phone numbers, and build a really strong relationship with our psychiatrists and licensed mental health counselors in the behavioral health center. So again, 100 Merrick Road across from King Cullen. I showed you the 4 days a week, 12 hours with the one day ending at 5:30, and that's the contact info that we'll share with you. These are the clinical team members for that behavioral health center, Rockville Center. We have two psychiatrists, Dr. Papivkar and Dr. Farhamandi. We have a psychologist, Dr. Kuzma, and then we have 3 licensed mental health counselors that rotate through the site, Jillian, Stephanie, and Nicole. Nicole is one of our mental health counselors that runs a school avoidance program. And then, of course, we have our medical associates that do everything from check-in to registration to scheduling to vitals. This is our care coordination team. They're mostly virtual because they support all 3 of our behavioral health centers, Belinda, Douglas, Carinas, and Sophie. And their role is to really connect all of our patients with long-term care. So the behavioral health center is available for immediate access and bridging care. So that means we're going to see the students immediately. We're going to assess their needs, make very specific recommendations. We're not about handing you a piece of paper that has 17 different psychologists for you to call on your own. We're going to find the ones that take your insurance in your community, speak your language, gender of preference, and target that down and help connect you with care. So that's what this team right here does. It's very specific care coordination to each individual child's needs. Okay, and we're going to talk about the goals of the BHC.
Yeah, so January kind of reviewed, but really the goal of the Behavioral Health Center, again, is to give that access. Lots of kids need an assessment. Families need guidance. You don't know where to start. What kind of specialist does my child need? Do they need a neurologist, a developmental pediatrician? That's for the younger kids. But do they need a therapist? Do they need a doctor? Do they need a social worker, a counselor? Who do they need? What kind of treatment do they need? So we can assess kids. We do mention crisis, but the center is not only for crisis. Really, if you feel that your child needs an assessment and needs to get connected to care, you can come get assessed and have our team help you get connected to the kind of care you need. And if you have urgent needs, meaning you urgently need to start medicine or need to start some support for your child because that's what they need, we're able to provide that while we're connecting you with the ongoing care. So that's really the model, is to assess, direct you to the best care, and help you actually obtain that care and connect to that care. Improving communication between everybody is an important issue. And what's important to know that you can access the center not only if your child is referred by a school staff member, member, although they can certainly help get connected, or if they have concerns, they can recommend this, but also you directly. So if you have concerns, even if they not come from the school, you want to call, you want to make an appointment, you can certainly do that. And then once the evaluation happens, feedback to the school only happens if we have medical release forms from the families. So if this is a medical office, like any other medical office, the information that is shared with that clinical team stays in that medical record that's protected with that medical team, unless you give us permission to release any information to other people, communicate with the school, help work together. Oftentimes it is very helpful, because often that is the best way we can help your child, is a school team and outpatient team kind of collaborates and works together to help. But I just want to really highlight that's up to each parent to decide about your child's care. Short-term treatment then happens, and then connection to long-term care. And like we explained, the care coordination happens throughout. We do have some frequently asked questions here, and of course, we're happy to take questions from you guys as well. Uh, but one common question is, do parents need insurance? So for the services that we described in the beginning, the webinars, the support groups, the education, all of those do not require any sort of insurance or information. Those you can sign up. Those are all free for the school community and the parents, and you can access them. They'll be shared with you, and you can access. If you are receiving treatment at the behavioral health center, insurance does get utilized to the extent that it exists, but we will see uninsured families and kids, and we will reduce high deductible plan costs to a co-payment amount, so nobody pays more than a co-payment for the care that they receive. And if they are uninsured and we're trying to connect families to ongoing care, our care coordinators can help support that need as well, and can help families establish insurance or establish the right insurance for their child for the care that they need. Information sharing we went over already, again, just with your consent. Sometimes when it's a crisis and a student gets referred in a crisis, there is the school wants to have a letter to be able to come back to school. So we certainly provide that. If we didn't feel that your child was unsafe, if we felt that they're unsafe, we're recommending that they go to the hospital, and we're helping you make that happen. But otherwise, if they're coming home and they can return to school, we'll provide that letter. You can always get a copy of an evaluation because it's your child's medical record. So you have the right to request copies of that at any time. We also have an electronic portal that patients can sign up for and access records. You might have that if you have other Northwell pediatrician or somebody, you might have that already. The notes, though, the evaluations do float to the portal. And then we can provide, of course, diagnosis and recommendations. That is the goal of the visit. Yes. Now compared to insurance. Yeah. Right. Right. Yet they have insurance and you see, no, they don't have insurance. But what if they have insurance, but it would be out of net?
So, yeah, I was going to say. Yes. So, first of all, at Northwell, there's almost in pediatrics, almost nothing that's out of network. It's probably like 3 plans that are out of network, like United Community Plan. Okay. So we take most insurances. In the event that we don't take your insurance out of network, it's regardless of the reason. Even if you have an insurance we take, but you happen to have a very high deductible plan, the idea is to limit barriers to care. Financial concerns is one of them. So no person is going to pay more than a specialty copay. So if you have $1,000 deductible you have to meet before your insurance kicks in, we're going to charge you the specialty copay. It's $50. It's usually around 50, but Mhm. 50, 50. Yeah. I hadn't heard of any insurance more than 50. Yeah. Yeah, so we reduce it down. And again, that's only possible because the partnership with school districts. We can't do this in any of our outpatient centers in any specialty that we have. But because of the partnership with the school districts, we can see uninsured, underinsured, high deductible, and non-participating plans. Sure, as many. It's actually above 12. Yeah. So anyone above the age 12, actually age 12, and actually happened to me at midnight of my son's 12-year-old visit, you're locked out as a parent. So that's the law. The kid can. So they have to open up their own portal. The parent no longer, once you're an adolescent, has access to a child's medical records through the portal. So the child, they can set up the portal. Oh, yeah. Yeah, the child would open it up, the portal. It's under their name. They open it. And I mean, listen, if you're doing it for them on your phone, I have no idea. But the law states that that the child can have the portal. The parent cannot. They can set up a patient portal. Yep. And they would have access to there. But if you went into the center and said, I want my child's last note, we would print it out and give you your child's last note. So yeah, no, that's when you can't, which is exactly what happened to me after midnight when my son turned 12.
Let's say you have a child on crisis and they're going to the hospital. What does a child seek that? How only don't.
I was going to say, take the mic for this one because
Yeah.
we could also tell you about Northwell's coordination of care for them.
Yeah, so this is not a C. So to clarify, this center is not a CPAP. It's an ambulatory outpatient office where we do have crisis access for kids. So if they do have to go to the hospital, we can navigate that. We do have Northwell EMS help get them there. If we're able, depending on the case, I will say, because 911 and EMS and that whole system, the way that operates, we don't always have full control of what happens. But we try to get everybody to come over to the children's hospital, or if a parent is cooperative enough and doing and the child is everybody's on board with coming to the hospital and that need, and we all feel good about going in a car, like we have had parents do that as well. We do coordinate with our team in the ER, so we will be giving handoff of why you're coming, that you're coming to get hospitalized for a bed. Unfortunately, at this point, we can only admit to a hospital through our emergency department. The way the emergency department looks, I don't have pictures, but I mean, it's very different than an outpatient office. In the Children's Hospital at Cohen's Children's, we do have a dedicated behavioral health unit within the pediatric emergency department. It's only children. It's a very small space, I will say. And because of safety regulations in the hospital, the experience itself is very different because you have to change out of your clothes, you have to give up your belongings, you have to separate from your child if they're going into the locked area. There's a security guard in there, there's cameras. It's a very clinical and safe environment because we have to do that there for safety reasons mostly, and regulations. So it's a very different experience for families to go through an emergency department than to come to the behavioral health center. And that was part of the reason why we created the behavioral health center, because some kids need the hospital, but most kids just need access. Most kids need access and evaluation and then help after. Most kids don't need to be admitted to the hospital, even if they're in crisis. And so here we're able to attend to kids without having families having to go through that hospital experience, which again, if we need to do it, we need to do it. And it's the safest thing for a child. And that's what we do. I'm the director of the emergency service as well. Yeah. We can chat after. Yes, sure.
But I would add, again, it is rare that we have to send anyone to the ER that kids are going. In fact, since we started the program, there was a 60% reduction in ER visits because of our program. In my own hometown where we started this, it was a 72% reduction in ER visits because of the program. But in the event that it's needed, the nice thing is that Vera is the director of all teams. And so her team in the ER know very well that the follow-up care that's needed, because if you think about the ER, they're going to look at the disposition, make a decision, you go home. and where do you go from there? So VRC will connect with our behavioral health teams and say, hey, this child's from Lynbrook, send a team's message. They need follow up. Our care coordinators reach out and then make sure there's a very nice, smooth transition back and to get you connected
Yeah.
into longer term care.
And that's true for not just the ER, but with Northwell, obviously Northwell is a huge system and we have access to partial hospital program, inpatient unit. And so when higher levels of care are needed for kids, we help navigate all of that with families. Other questions?
Without going to schools to get help, they can do that all.
Yes, absolutely. Yeah, that's why we're here tonight because we want, and we'll go to PTA meetings, we'll go to board meetings, go to SEPTA meetings. It's really important in this partnership that the community knows about us because, again, that's another barrier to care. The idea is to really block down all barriers. So if anyone wants to go to the behavioral health center, you can call up. I tell every parent actually that everyone knows my friends, save the number. You don't need it today. You never need it. But when you do need it, the last thing you want to do is search around a website or an email or, to find that number. So I always encourage people to save it now and you can call it whenever you want. Yeah. Those are some Oh, the other thing there was, and this also was anyone who lives in the school district. So if there's out of district placement or one of the students goes to a private school, they have the same exact access to the behavioral health center than if you were attending one of the public schools.
So
Yeah.
other couple questions about ages of kids.
Yeah, there are. I mean, you probably have older kids, although some of you may have younger kids or neighbors, but that we do see from preschool up. So we say school age kids. So usually around 3, 4, or 5, although typically 5 and up. And it goes through school age kid again. So for the typical child, it's 18, but for some kids in the special ed program, they might be in the school district until the age of 21.
Once they're 18, they have to consent for themselves, as you may know, like for any other healthcare. So once they're 18, they have to be agreeable to coming. They find consent. And in fact, you have to have them sign a release to talk to you or share anything with you. Actually, not to talk to you. You can share anything with us, but we can only share information back if an 18 or above child signs the consent.
And we do have staff that speak many different languages, obviously, certainly not a dent in all of the languages. And so we do have a kind of FaceTime interpreter line, but it is nice that it's not a phone line. It's like a big iPad. So you actually have a person in the room with you live that's helping to do the interpretation.
Which is why they also offer sign language.
Yeah. Go ahead.
Yes. Right. In your availability, people that speak other languages that can present friendly, or even clinicians. So we do have some health educators and clinicians that are bilingual Spanish, and we have some other clinicians that speak other languages. So we can, we have done that with districts. We've also collaborated in the district, maybe had a staff that spoke the language and that they translated. So we do a variety of things. Here we can use to have somebody who speaks another language and come in and speak and yeah, we to hear it in Spanish. Sure. Yeah, we do that. Yeah.
Most of our events are virtual through Zoom, where we can sometimes can get transcribed later. It depends if we have the availability to do that. But we do have the ability to kind of do some more custom in-person programs if there's something specific to a district that's not covered in our very wide library of a community that we do.
These are just resources. So I'm sharing this because I know it's back to school, especially high school, especially is difficult and often time for kids, time management or how to manage the many commitments that they're making through high school and their time can be a struggle. So actually, these are really wonderful resources. There's toolkits directly for parents to help their kids and also for the kids themselves. And then we just collected a couple of other helpful parenting resources. This will be shared with you guys for back to school, for digital, emotional wellness, other reliable health information on various topics. and then helpful apps for kids and ourselves to utilize some good practices for managing our stress, and then some of the phone numbers that are maybe worthwhile having, and some other resources that we have for support for kids with stress and trauma. Yes.
Yeah, we're
They-
actually
well,
trying to get involved with the
Right.
yeah.
So we're trying to build our own resource for families, actually. So hopefully we're able to launch that, because that is something else we're trying to do for the schools, is to have digital resources for kids and families that they can utilize. So stay tuned. It's something that we're actively working on. Yes.
Yes. Yes, we send it to the school and they can send it out or share it out in any which way they share things. Yes. And that is gonna be the case throughout the year as we do presentations and share resources, they'll be shared.
And the monthly newsletter is a great kind of repository of all our information. Yeah. Yeah. Any other questions?
All right, we're very excited and we're very weekend. So
Nice meeting you all.
Okay, thank you very much, and perfect timing. I'm very grateful for this partnership. I think whenever a child is in a crisis, or anything that falls short of a crisis, the what to do first and then what to do next are always very daunting questions to answer. So I love this idea. I love that you can either include us. We have wonderful relationships with our parents and students, but also if not, that you're able to go directly to them as well. So it's something that we're all very encouraged by. So again, thank you for your time tonight. Yeah, absolutely. Thank you. Yeah, so we have some handouts in the back of the room. And actually, at this point, if we could all go to our first period class, that'd be great. Thank you very much.